Let's talk for just a minute about dental supplies. With our specialized population, you may find yourself going through supplies much more quickly. Before we talked about the toothbrush, making sure that we're always using a soft toothbrush, I really want you to pay careful attention though to the actual bristles of the brush. So many of our clients are toothbrush chewers, or they're brushing with so much force that they're actually destroying the toothbrush pretty early on. So make sure that the bristles always are remaining upright and that they look pretty much as a brand new toothbrush should look. If your client gets ill with something, go ahead and replace the toothbrush too. We don't want to take a chance on reinfecting anybody. It's not just the toothbrushes too, though, that we want to pay attention to. Things like the other adjuncts that we might be using. Here I've got a dental pick that we could use for someone who can't be flossed. Just a different manipulative that we can use to go in between the teeth to remove any of the bacteria or food debris that's collecting there. And there's all different kinds that you can use. This one is one that you just rinse off in water when you're through with it and it can be used again. Or these gum picks that can be used in between the teeth. They're very small, so maybe a little bit harder to handle, but super quick and easy to work with. These are disposable, but you want to make sure as you're going through all the areas that the tip of it isn't getting bent and damaged. If it does, they're very inexpensive. Just go ahead and throw it out and take a new one. Also, there's other devices that we can use. We talked about these different kinds of bite blocks. So if you're using this in the mouth, make sure that it always looks as it did when you first took it out. So you want to make sure there's no pieces missing from it or anything that could pose a potential choking hazard. And again, whenever we're working with clients and in their mouth, we always make sure that we are wearing gloves. I've recommended in the past different kinds of timers that we can use. If you are using a timer, you just want to make sure that it's also in good working order. Sometimes they start to get clogged up, they get water in them or whatever over time. So you want to make sure that the timers are okay. If they break, they are made out of plastic, but we don't want to take a chance on anyone getting injured with anything. So as you're working with your client, just make sure that you're keeping an eye on the products that they're using to make sure that they're in excellent working order. Also, I'm finding that with a lot of our clients, I'm trying to use the small sample size toothpaste so that as the client is squeezing it out, they're not having issue with squeezing out the entire contents of a tube of toothpaste and just letting it all go to waste. Also, keep an eye on the cap. Some of them have the screw-off cap, some of them have a flip top. Discover what works best for your client so that they can manipulate things as best they can on their own. Remember, everything that we're doing, we're wanting to encourage independence for them. So if one cap type works easier for them or one flavor is better and more easily tolerated, go with that product for them. Thank you.